honor to have Ms. Kwan Young Hee present our program entitled Addiction Medicine Specialist Dr. William Glatt Discusses Opioids, Part 2 of 2.
이번 2부작 방송을 통해 미국 캘리포니아주 벌링게임의 존경받는 내과 전문의이자 중독의학 전문가인 윌리엄 글래시를 모시고 오피오이드와 통증 치료 및 약물 중독의 유형에 대한 그의 전문 지식을 나눌 수 있게 되어 영광입니다. 오늘은 오피오이드 중독에 관한 글래시의 말씀을 들어보겠습니다. 오피오이드가 강력한 진통제라고는 하나 유감스럽게도 사람들은 그것에 의존하게 되어버립니다. 통증을 극복하기 위해 오피오이드에 의존하는 사람들에게 복용을 멈추고 그것을 멀리하는 일은 말처럼 쉽지 않습니다.
I think there's an attitude of just get off the drug, just say no to drugs. It's not that easy. It's not a lack of courage or willpower or mental illness. It's a brain biochemical imbalance. After you used opioids, but it's the same for other addicting drugs, after you use it for a period of time, there's like an invisible line in front of all of us. If you come from a background of sexual abuse, physical abuse, mental abuse, or there's a strong family genetic pattern, you're much closer to that invisible line. And once you cross it, you can't go back. You have to be very, very careful and work with a physician who understands addictive disease so you don't fall into the trap and lose control again. Some of the local brain centers in the brainstem where the pain centers are come under a lot of control, and there's a lot of feedback between these different centers. If someone is in withdrawal from heroin and they get some product and they know they're going to shoot up in a half hour, just like that, the withdrawal symptoms go away because the body has natural opioids. It knows it's going to be fed shortly, and the withdrawal symptoms sort of melt away. That doesn't mean they don't need to use as soon as possible, but it's a biochemical imbalance. And very often these people over a period of time, it's like the thermostat gets reset. And we talk about homeostasis, which is balancing between different parts of the body to keep our temperature 98.6 plus or minus a little bit. And those balancing centers get out of whack if you cross that invisible line. And a lot of scientists have studied this in humans, and the thermostat gets reset. So what the body is seeking is to be normal, and the only thing is normal is loaded with opiates.
오피오이드를 처방받은 환자들은 오피오이드 중 하나인 헤로인에 중독될 위험이 있습니다. 더 쉽고 저렴하게 구매할 수 있기 때문이죠. 미국 정부 기관인 국립약물남용연구소에 따르면 도시에 사는 마약 주사 복용자 중 젊은 층을 대상으로 2008년과 2009년에 인터뷰를 진행한 연구에서 86%가 헤로인을 사용하기 전에 처방 없이 진통제를 복용한 적이 있으며 이러한 복용의 주된 계기는 가족이나 친구 또는 개인적인 처방을 통한 세 가지로 나타났습니다.
In many different communities, people are not getting the treatment they need. Many of these people, especially if they start at a young age, they start in their late teens, and by the time they get into their 20s, before they die of opioid deaths, overdoses, because of tainted heroin, they need to get in long-term treatment. What's long-term treatment? Probably 3 to 6 months at a minimum.
오피오이드에 중독된 후 복용을 멈추려고 하면 몇 시간, 며칠 또는 몇 주 동안 금단 증상을 경험하게 됩니다. webmd.com에 따르면 약에 대한 갈망, 설사, 동공확장, 하품, 복부 통증, 오한과 소름, 메스꺼움과 구토, 몸살, 불안, 그리고 극심한 불쾌감 같은 증상이 나타날 수 있습니다. 이제 글래시가 환자들이 오피오이드 없는 삶으로 전환할 수 있는 몇 가지 방법을 설명해 줍니다.
It's just not getting off the drug that's important. That's not sobriety. That's abstinence. Abstinence is good, but then you need to have a program of recovery, whether it's going to meetings or therapy, individual, group, there's a whole variety. Medication-assisted treatment is a substitute, so there are several different options. The most common one is Suboxone or buprenorphine, and Suboxone is one brand. The gold standard has usually been buprenorphine, which reduces craving on a long-term basis. Some people need it for a lifetime. Some people need it for a year or two. There's a lot of variation. The other one is to get them off opioids completely and then use a blocker like naloxone, which can be a pill. Probably the best is medication-assisted treatment combined with psychosocial therapy. Getting family involved is crucial. Having a safe place to live. And most of that is in the American Society of Addiction Medicine. Their placement criteria helps you decide at what level of care. Some people need to be in a controlled environment, so they may go for 30 or 60 days to a structured rehabilitation program and then go to what we call a halfway house, where they're clean and sober living, other people in recovery, and they test them very frequently.
글래시는 환자들에게 매우 친절하며 특히 약물 중독 문제가 있는 사람들에게는 더 그렇습니다. 그는 자신이 보는 모든 사람들이 건강을 최대한 개선하고 양질의 삶을 살기를 진심으로 바랍니다.
My heart goes out to those people because they get trapped. They get trapped biochemically. My colleagues sometimes say to me, how can you take care of those people, meaning alcoholics and addicts? And I say they're all wonderful people. That those that get into recovery and I take care of, they love me and I love them. And those who don't want to get into recovery, they go somewhere else. They don't come back to see me. So I have the best of both worlds. I have people who love me and I love them, and people whose lives are magically improved, and especially the chronic pain patients that are not addicts. Their lives now work for the first time. They can get up in the morning.
시간을 내어 오피오이드 중독 및 치료에 대한 전문가의 의학적 견해를 나누어 준 그레스 선생님과 그의 자비로운 활동에 감사드립니다. 그레시의 친절한 관심과 배려가 앞으로도 더욱 많은 환자들의 삶에 감동을 주기를 바랍니다. 윌리엄 그레시와 중독의학에 대한 더 자세한 정보는 다음을 방문하세요. gladmedical.com